Shall you rise? Pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Good evening. Welcome to the June 26, 2024 regular meeting of the Washington Township Healthcare District Board of Directors. Public notice for this meeting has been posted appropriately on our website. Tonight's meeting is in person and also accessible by Zoom. I ask that you please mute your system until such time as you need to speak. We are recording tonight's regular sessions of the board meeting. It will be posted on our website for future viewing. Shirley, roll please.
Director Eaton?
Present.
Director Wallace? Director Nicholson?
Present.
Director Yee? Present. And Director Stewart?
Present. All right, move on to oral communications. Members of the public are invited to speak during oral communications. When prompted, please state your name for the record and then proceed with your statement not to exceed 3 minutes on issues or concerns not on the agenda and within the subject matter of the jurisdiction of the board. Are there any members of the public who would like to speak?
Yes.
Are they coming in?
Yes, this is group 1, this is group 2, on their way in.
Thanks.
Still finish saying that because there might be somebody online.
Oh, yes, that's true. If there's anybody online that wants to speak.
Not at this time, not online.
Yeah, you're right. Charity.
Come on in? Mm-hmm.
Yeah.
Nine percent is not charity. Thank you, Jerry.
I don't want
Masters. Yeah.
We're waiting for you. John, why don't you come up to me?
All right. Set my boba down next to you guys. So, where are you guys taking the speakers right now? All right.
Yeah.
So I'm just gonna open it up for you guys.
So we have 2 minutes per speaker, so if you can, and then, yeah.
Perfect. All right, wow, you got a Zoom screen going on here too. So, all right, well, thank you guys for taking the time to meet with us. My name is Grant Hill. I'm with the Engineers and Scientists Union. You guys know me. I'm here with my folks from the rehab department, and so I'd like to introduce you to them. We have a few speakers today that'll be coming up, so feel free to call on them. I'm proud to be here with these folks and with all of you. Thank you.
All right, I think the first speaker is Charity.
Good evening, everybody. Thank you so much for listening to us today. My name is Charity. I'm an occupational therapist here, and I've been here for 27 years. I feel that the rehab department is a forgotten department. If God forbid, if anything happens to you or your loved ones, your family members, like a stroke, paralyzed, unable to swallow, who do they turn to? They turn to us. speech therapists to help to swallow, PTs to help to walk, and the OTs to help function again for the quality of life of the patients and the care that we can provide for your family. I feel that we don't often get acknowledged for our efforts, despite being top in the nation in IJR, being certified in spine and neuro certifications. Rehab is a part of all of that. And I think that, we often are taken for granted. And so we only want a fair contract so we can continue to provide the care and the quality for the community. Please stop taking things away from us. We're only asking to, know what we deserve and just do what's right. Thank you so much.
Next, we have Sarah.
I'm Sarah Garify. I'm a speech-language pathologist. I've been PRN here for about a year. I work 2 to 3 days a week. And I've been disappointed to see the negotiation process here for this new upcoming contract, especially with, constantly having the times pushed for meetings, making it hard for us to actually show up and be able to attend during our lunch hour, and then it gets pushed and we have 15 minutes to come out during our break and it gets pushed, and so it's hard to get our voices heard. And with that, we're just trying to ask for a fair contract and fair pay. I happen to also work within the Bay Area at Good Samaritan Hospital, doing the same job, acute care speech pathology, PRN, and there is an 8.5% difference in the pay rate between the work at Good Samaritan and how they're compensating versus here. And in my mind, my priority is the patients, and I want to be able to keep showing up for our patients and be able to keep the good culture of Washington Hospital going. But it does become difficult when cost of living goes up here and the pay scale doesn't keep pace. Thank you.
Next is Kathy Din.
Hello, good evening, board members and administration. My name is Kat. I'm a physical therapist, and I've been here at Washington Hospital for almost 8 years. I grew up in Union City and volunteered here at this very hospital in high school. I am, like many of us are, the community. It is extremely disheartening to see how much this hospital undervalues rehab, despite us going above and beyond our responsibilities, even during the pandemic, when our wage adjustments were nowhere near inflation. And if you guys need the data for that, we can certainly offer it. But how long can being undervalued sustain? The hospital has incredible potential to be extraordinary, and I've seen that here. But each and every time we lose outstanding clinicians to hospitals who value them, we will always lose that potential to be extraordinary. Rehab currently is 12% below market rate. By Monday, if we compare ourselves to trauma hospitals in the Bay Area, we will be 15% below market rate. So I would like to ask the board, how can you all expect a 4.5 average wage adjustment be fair when that will nowhere meet the market rate? How is that valuing your communities and your superheroes?
30 seconds.
Thank you.
Thank you.
Thank you. Next, we have Catherine.
Hi, and thank you for allowing me to speak today. I'm Katie. I'm a physical therapist, and I've been here for almost 5 years. And I'm speaking to express our need for fair wages and fair contract. Whenever we have an administrator or even our own supervisors speak to the quality of care and work that we provide, we are consistently being told, we appreciate you, we value you, you're the backbone of whatever. You make a difference to patient access and patient care.
As much as verbal praise is nice, it doesn't truly evoke appreciation and value. We deserve fair wages. We are 12% below market. You guys can't make up for that with pizza parties and food trucks. With pizza and food trucks, like, what's that to you? We have families, we have kids, we have our lives in Fremont, and this community that the hospital has dedicated itself to serve. So it's us, and this is how we all feel every day. And despite all that, we show up, we care for our patients, we stay late, we do everything we can to make sure our patients get everything they need before they go home. That means telling them what they expect when they leave here, telling them what to do. Caregivers, patients, where do they go? What do? You just had to show your whole life is upside down. Who's going to help you? We're the ones that spend the time with the patients to do that. We've been in the room to see other physicians and healthcare professionals just walk in, say what they say, and leave. We're the ones that are still left standing in the corner waiting for our time to teach them how to put on your socks, how to walk, how to use a device, where to go, and how to get better and how to get your life back. So I think we deserve fair wages and a fair contract. Thank you.
Thank you. Next, we have Jermaine.
Hey everyone, I'm Jermaine. I'm an occupational therapist here. I've been here for 27 years. I love this hospital. I was raised in Fremont. I went to Kennedy High School. This is my hometown hospital. I love it here. I love the people here. We are so underpaid. Everyone in this room, I'm not just talking about rehab, everyone in this room wants to feel like they're appreciated. And honestly, we do not feel like we're appreciated. There's so many things that we do because we do it because we love our patients. Okay? Everyone here, you guys do what you do because you love patients. This is why we're in healthcare, because we love our patients. But living in the Bay Area, it is so hard nowadays with inflation. You guys go grocery shopping, you get gas, you know how expensive it is. And we love being here. We got so many people now that are leaving. Some of my closest friends are leaving literally next week. Some to retirement, some to better jobs. Because other places are paying better. The benefits are better. They're not having things taken away. I'm talking not just rehab, case managers, just other departments. And aside from us, I feel bad for my hometown hospital for this happening. I love this place. So we're just putting it out there. We love to be here. We want to stay here. And we just want fair wages. Thank you, guys.
Oh, we have another.
You have another group? Okay.
So this was group one.
Okay, thank you.
Yep. Thank you, guys.
Thank you.
Thank you. Thanks. Thank you.
Thank you. You too. I didn't hear what.
That group.
That's the one that's coming?
Yeah. Those are, that's
Hey,
for
Peg,
Jill.
I'm also working in corporate,
Say something at the end.
the next draft.
Yeah.
So then,
Yep.
that's it.
Okay.
Unless you have any
No,
changes to the
it was
others.
exactly.
Okay.
That was quick. Thank you. Exactly. I think it's just simpler the way that you've
I
written,
know, that.
taking the money off the stipend up front and then doing the reconciliation on the backside for the other piece. I need a physical therapist right now.
You were telling, didn't you? Catch someone coming through the next room.
Must be on my head, it's gonna explode.
That's my heart. Yeah, Tom.
Just make, just wrap it.
Yeah. Does somebody have a stroke and a heart attack at the same time?
The pharmacy?
Yeah.
Rehab.
Sure, it's real.
All right, so this is our group 2, so we appreciate the time that you guys are taking to listen to us today. And this is our group 2, so feel free to call on the names here.
We'll
All right.
give everybody 2 minutes.
So the first speaker we have is Mechi.
Hi, everyone. Thank you for having me here. My name is Mai Chi. I'm the ED pharmacist. I have been here at Washington for 14 years. When I first came here, Washington was a great place to start and where I built my career. Despite being smaller than other hospitals around us like Kaiser or Stanford, we have a great clinical program, good health benefits, competitive pay, and experienced and highly skilled coworkers. Throughout the years, I have trained many students, residents, and new pharmacists. Many have stayed and helped us expand our program, like the infusion center, the medication reconciliation, the transition of care, just to name a few. Did you know that here at Washington, some of the protocols that pharmacists manage are not done anywhere else in the area, such as insulin? And did you also know that we have the highest percentage of advanced certification and dual certification for pharmacists compared to all the hospitals around, like Santa Valley, Kaiser, John Muir. However, in recent years, especially last year, a lot of our young and bright pharmacists have left. It's very heartbroken, but I completely understand. Washington is no longer the place to be, but a stepping stone for all the hospitals. Pharmacists come and gain knowledge, feel experience, and leave. It's so disappointing and exhausting. We have constantly wasting our time training new pharmacists, and then they leave. A lot of us here really want to stay with you to help build and maintain the high, care that we pride ourselves in, but it's getting more and more difficult just because of the change in the health care, the low competitive pay. And so we hope that you give us a fair contract so that we can stay here and make Washington once again a place where we can give our dedication. Thank you so much for your time. Thank you.
Next we have Stephanie.
Hi, everyone. Ladies and gentlemen of the board, thank you for allowing me the opportunity to speak to you today. I have been an ER ICU pharmacist here for almost 10 years. I truly value the work that we do and the team that stands with me, especially during the challenges of the pandemic. But during our last negotiation, we accepted an unfair contract. We were sympathetic to the needs of the hospital for those unprecedented times. We prioritized our patients and the hospital, even if it meant personal sacrifices at that time. And today we stand before you to ask for a fair contract. This isn't just about the wages, it's about ensuring that we have the resources to continue delivering our best as we expand our services for things like the brand new trauma program. The pharmacy department here at Washington Hospital is renowned across the Bay Area for its rigorous clinical program, as Mai Chi mentioned. Yet, pharmacists I've personally trained also continue to leave after securing their pensions due to stagnant wage increases. Here in Washington, there's only a 12% difference in wages between a new grad and a seasoned pharmacist with almost 30 years of experience. We've also lost many skilled technicians to more competitive healthcare systems. Witnessing this talent drain is really heartbreaking and, very discouraging. Our dedicated professionals deserve a contract that acknowledges our hard work. It's crucial for our well-being and also that of the hospital's future in retaining proficient and competent staff as we expand to meet the needs of our growing community.
30 seconds.
Thank you for your time and consideration.
Next, we have Christine.
Hi, good evening all. My name is Christine Pham, and I've been working at Washington Hospital for 5 years, and I've been a clinical pharmacist for 11 years. I began my loyalty here prior to COVID. As scared as we all were, we placed our patients before our families, even our health. We maintain our duty of considering the welfare of our humanity and relief of our suffering as a primary concern. We all worked together, we were dedicated, we were loyal. We accepted a contract despite how unfair it had been already, but we understood the seriousness of Washington Hospital's needs and the pandemic that affected us all. At the start of COVID in 2020, the pharmacy department started a transitions of care program and efforts to assist in the reduction of readmissions. I was heavily involved in developing the TOZ program, from adding new workflows to the already vigorous pharmacist workload, providing training, attending countless meetings, and essentially brought it up from the ground up. These were the demands of the hospital, and we did what we could with those demands, and while still embracing goals and hospital initiatives. We embraced changes to improve patient care even under the lack of resources we had. And for some time now, the balance of needs to satisfy hospital goals have become exceedingly imbalanced with our very own livelihood. Pay, health benefits, earned time off, inflation, increased cost of living. How can we withstand living and upkeeping our first ethic mission if the compensation due dollars are reason to work for Washington Hospital? We are all professionals here. We know our worth and we choose to stay here because we are loyal, but how long can we stretch loyalty over the worth of us as a whole? For the same reason, another highly professional pharmacist resigned after answering those very questions, and he started business in the Bay Area. For him, even starting a small business in California with all the regulations failures that have happened was more lucrative than staying at Washington Hospital. We are not asking for anything outrageous that can't be shown through our work and dedication. We are asking for you to be serious with our needs as much as we have been serious with your needs. We are asking for fair pay to stay. Thank you for letting me speak here today.
Next speaker is Rehan.
Good evening, esteemed members of the board. My name is Rehan Nouri. I've worked with Washington for over 16 years. I've been intimately involved with helping establish pharmacy involvement with the infusion center and brought it to where it is today. We all know that Washington Hospital has been instrumental in bringing state-of-the-art resources and people, such as our affiliation with UCSF Cancer Center. We bring the best and the brightest to help build our program. But as you heard already, some of the best and the brightest from amongst our own staff members are leaving as well. 6 years ago, I said goodbye to one of our oncology pharmacists who helped pioneer pharmacy's involvement in the oncology program. And yesterday was my last shift working with another pharmacist who's moving on to another institution as well. As Stephanie mentioned, even if I work 30 plus years here, my wages would only increase by 12% as it states in our current contract. Do you think the small inflationary adjustments we've been given have any significant impact on someone who's given half of his year, half of his life to this institution? Where's the adjustment for loyalty? I mean, I never would have thought staying loyal to an institution would actually hurt me financially. What incentive would there be for me to stay to continue to build the future of Washington Hospital when it doesn't seem like there's a future for me or my colleagues? Dr. Nicholson, we've had many mutual patients together over the years. Kimberly, I've presented in front of you in this very room and other members of the executive team when I was Med Safety Officer. I hope you can appreciate my personality as very genuine when I say that we actually give our heart and souls to this institution. Amongst this group that's standing here are members who've established 4 of the greatest programs that we've had in this hospital. We've had transition of care, which started from the ground up, our infusion center, which unfortunately some of the members have left. We've had emergency department about 10 years ago. Some of the pharmacists here have established that. And of course, Alaris Epic interoperability. We did that for this hospital. So when we speak to you, we speak not as pharmacists who appear to just want more money. But we hope that you see our request actually has some merit because of what we've done for this hospital. We've truly done our best to accommodate the hospital in its time of need, and we only ask that the hospital reciprocate that and do the same for us today. Thank you very much. We urge you to side with our request for a fair and just contract. Have a nice evening.
We have Peter.
Good evening, everyone. Members of the board. My name is Peter. I'm a pharmacist. So Winston Churchill has said, courage is about the ability to stand up and speak up. Courage is also about the ability to sit down and listen. And I'd like to applaud all of us for doing just that tonight. Again, my name is Peter. I've been an ICU pharmacist in Washington Hospital for 15 years. I've also lived in Fremont for the past 15 years. I'm very proud of both facts. I love my work, and I love the coworkers that I have, most of them anyway. Unfortunately, over the past 2 years, it's a little bit disheartening as well as alarming that I'm seeing more and more of my colleagues departing and took up positions in other Bay Area hospitals. When I first started out, Washington Hospital has one of the most highly sought-after pharmacist positions in the area, partly because of the competitive salary and excellent benefits package. That's one of the reasons why I came here. Unfortunately, as I mentioned before, due to the recent economic restraints, the hospital was put in a difficult position, and during the last contract negotiation, I think we made a huge sacrifice and compromise in making minimal, if any, demands in increased pay. So if our motto is to provide the best patient care possible, I think we should also do our best to retain and attract the best talents possible, like me. So with that, I know we can come up with a reasonable agreement that will make us more competitive rather than again. Thank you for your time. Have a good night.
I think I'm Lee. Do we have another speaker, or?
I don't think so.
All right, so I'm the closer. All right. All right, well, we thank you guys for the time tonight and for taking the time to listen to our ESC membership. I just want to give it up for them again for taking the time today to, speak their hearts and minds with all of you. So I'm very, very proud of you guys for everything that they do. So I'm a union rep with ESC, and I represent 10 hospitals throughout the North Bay, the South Bay, and the Central Valley. And I can share with you guys that unfortunately, the wage rates here are not as competitive as a lot of facilities, as you guys are hearing. I mean, we had Kaiser, which did a 6%, a 5%, a 5%, a 5%. We had HCA, Good Samaritan, and Regional, which did a 6.75, a 5.25, and a 5. There is Dignity, which was a 5.445, but all of these places are not making cuts to healthcare. They're not making cuts to the retirement, and they're trying to bring people in. And so this is a big concern for us, and as they've spoken to today, we're losing a lot of people. And unfortunately, yesterday I heard from a few union members that are also going to be leaving Washington, and they shared that with me privately. And so that's, it's sad for me too, because I work with these people and I know how much they care about the patients, and I'm finding out that they're going to be leaving to other facilities. And so, all they're asking for is to be, paid for their value in the market that is being paid across the street at a rate that unfortunately is not being put in the proposals yet from the hospital. So, right now it's 4% and some change. We're still a little far apart. We're at 9, 8, and 7 on our side, and you guys are at 4.5, 4.75, and 4.75. But with cuts to healthcare, and you guys have proposed, or at least your attorney has proposed, to have a reopener on retirement. I I don't know why that is a proposal when it wasn't given to the nurses and it wasn't given to SEIU. So that's a huge issue for us. It would be a strike issue. The wages are, and the fact that we're talking about cutting people, having the ability to change people's retirement. So, we ask you guys to reconsider, and when we go into mediation, hopefully next month, that we come back with a serious proposal. And in closing, I'll share, because I'm sure you guys got a different side of the story, but you can talk to us or you can talk to myself. The last negotiation session did not go as planned, unfortunately. I see some faces, so you guys probably heard Martha's side of the story. We shared with her that we were going to start doing the buttons and the stickers. That was shared with her privately by Kushang over there and myself, so she knew. It was not a surprise. We said we're not happy with the 4%, so we're going to start wearing buttons and stickers. She blew up and in front of about 50 or 60 people. And she said, okay, we're going to do mediation. But not only did she blow up, she threatened our members. And she was yelling, and she said, we are going to start enforcing strictly the code of conduct because some people don't know how to act professionally. And she's saying this to people that basically have doctorates, went to university to work with patients. And so we're not going to deal with an attorney that is going to be that condescending, and we're not going to be quiet about it. And so I have to speak up when people offend our membership. So hopefully with the mediator, we'll have a better relationship with her, and hopefully we will get an offer from you guys that's realistic, that we can actually agree to, that shows the market for where it is, so we can keep these people who are so talented and want to care for your patients. But it's my fear that if you guys don't come back with something realistic, we're going to continue to lose these people to other facilities. So thank you guys for your time tonight, and thank all these folks for coming and speaking tonight. Appreciate it. Thank you. Oh, and I'm going to get in trouble. I'm going to get in trouble with my folks if I don't share this. This is the last thing. I know, but this is the very last thing. You guys got time. You got cheese and crackers and cheese. The very last thing that I'll share with you guys is that our folks are also upset that they're told that the wages have to be at the 50th percentile, but the board has decided that the CEO, respectfully, is at 65th percentile. So how can you be talking about cutting people's benefits or cutting people's retirement, but yet you're putting the CEO's pay higher than, respectfully, the people that actually run this hospital and deal with the patients day after day? So that's something that these folks are concerned about, and I'm here to voice that respectfully. It's not about you personally, but it's about the decisions the board is making, and I hope that the board takes that into account. So thank you, guys. All right, folks.
That should conclude the speech for tonight.
Yes.
Thank you.
Thank you.
Thank you, everyone.
Thank you.
Can you grab my...
Right, thank you.
All right, so keep moving. Shirley, are there any written communications?
There are no written
Yep.
communications.
And we'll move on to the consent calendar. The consent calendar consists of those agenda items that the board will approve with one motion unless either a member of the board or a member of the public requests to remove an agenda item from the consent calendar. If any items are removed from the consent calendar, the board will take action on the removed agenda item later in the meeting under the action item heading of the agenda. Does anyone on the board want to remove an agenda item from the consent calendar? No? Does any member of the public want to remove an agenda item from the consent calendar? No? So may I have a motion to approve the consent calendar items A through G, Director Nicholson?
Yeah, Mr. President, I move that the Board of Directors approve the consent calendar items A through G.
One second. Director Eaton?
Aye.
Director Wallace? Director Nicholson,
Aye.
Director Yee,
Aye.
and Director Stewart.
Aye.
Passes. So the next, the presentations.
All right, next on the agenda, we are going to present the budget estimate for fiscal year '25. And Thomas McDonough and Jessica Haviland are going to do the presentation. I'm just going to take a minute and introduce both of them. So to begin with, Thomas McDonough, as Tom, joined Washington Hospital Healthcare System in February of 2023 after working the last few years for 2 tribal health systems in Alaska and a rural community hospital in central Washington. Prior to that, Tom worked 22 years with Providence Health System. For the last 7 years with Providence, Tom served as their CFO of Shared Services and SVP Treasurer. Tom graduated from Washington State University with an undergraduate degrees in economics and finance. His graduate degree focuses on business analytics and administration. As CFO, Tom has accountability for accounting, audits, revenue cycle, payroll, payer contracting, treasury, financial planning and analytics, budgeting, and benefits programs. Next, I'd like to introduce Jessica Haviland, Senior Director at FP&A and Treasury. Jessica joined Washington Hospital Healthcare System in March of 2024 after working the last 10 years at Providence St. Joseph's Health System in Renton, Washington. At Providence, Jessica was a finance director leading the $6 billion capital portfolio. Prior to joining Providence, Jessica was at Walmart stores in Bentonville, Arkansas for 10 years in various finance functions focused on the U.S. division. Jessica graduated from Oklahoma State University with a Bachelor of Science in Business Administration and continued on to get her Master's in Business Administration as well. As Senior Director for Washington, Jessica has accountability for FP&A, Treasury, decision support, and strategic finance. This includes cash management, reporting, budgeting, forecasting, analysis, data management, and strategic analysis and pro forma reviews. So it is my pleasure to turn it over to Tom to begin the presentation for the budget for this fiscal year '25.
Thank you, Kimberly. I'm happy to present the fiscal '25 budget for the hospital, Washington Hospital Healthcare System. I'm going to take us to slide 2. I guess I'm driving myself. No, it's fine. Our mission statement continues to drive the strategic plan. It continues to drive the work that the people that you just heard from and those around the table do on a daily basis. I won't read every line item, but I do think it's important to say that to support the fulfillment of the mission at the very bottom, the district's strategic vision is to be the regional medical center of Southern Alameda County and offering services that span the full range of care within the available financial resources. And so it is a balance, and you'll see in our budget that it is a balance between a new program like trauma and still trying to grow our financial strength. And, that's important to the community as well. So our healthcare environment, just a few quick points. You know, we continue to provide, as you also heard earlier, high quality care to our patients and the community. We do this through not only the hospital, but our affiliates and our partnerships. The health system, as it moves forward, has endured a few economic challenges. The economy hasn't been great. Labor has continued to, cost for labor has continued to grow. We have shortages in specialties and other areas. And so it's not just about the dollar, it's about work-life balance and other things. And, you know, we changed the health plan this coming year for wellness programs so that we can start bringing these balanced things to the organization. Continued economic volatility, and then despite the internal challenges, you know, we did make a really solid path forward in fiscal '24. We accomplished 70% of the initiatives that we put out there at last fiscal year. And you saw that in the work that everybody has done, from the bringing in 2 physicians for the cath lab and other things. So it's still exciting to be here and the services that we're offering. And the management team works diligently towards these goals, as you know, but so do the staff and the employees and the medical staff. And it's very important that this be a partnership amongst everyone. So I'll just highlight a few of those for you. We are prepared to be Alameda County's next trauma center on Monday. We have established the ROC, or Radiation Oncology Center, as a standalone JV partnership with UCSF. It's structured as an outpatient department, and that is so that we are maximizing our opportunity for reimbursements. We're going to grow the cancer center in fiscal 25 with the build out of the regional cancer center at 2500 Mallory. Warm Springs continues in development. This is going to be a full-service health center with the pharmacy, clinics, ASC, and advanced imaging. The bridge that links the IJR/hospital to Morris Hyman was completed on time and pretty much within budget. A focus on our IT and IS infrastructure is prepared to move us into fiscal 25. We have added contract management software, coding software, charge capture software, and we're automating a lot of manual legacy tasks with this software. And we look forward to continuing moving that forward in fiscal 25. We've also done a lot of updating to our clinical systems with the new PAC system coming online in fiscal 25, scheduling systems, authorizations, centralizing and standardizing that, and then expanding the functionality that's available in MyChart. And then, of course, it'd be remiss if I didn't mention strengthening our cybersecurity and our storage facilities. You'll see on our capital asks, there's a couple of asks around IS storage. Those are the more state-of-the-art storage facilities. And then embracing artificial intelligence where we can for patient care. Our value in the non-clinical staff also took great strides in our market competitiveness. We completed 4 union negotiations in fiscal 24. As you see, we're on the 5th one right now. And we're really looking at our total compensation, which is our pay and our benefits, and not one in isolation over the other. And then consolidation of the Whitmith or Washington Township Medical Foundation into the Fremont Office Center is going to take a big step forward in fiscal 25. And that will be welcome relief both for Whitmith and the community, because it's going to have everybody under one roof. Any questions? So headwinds as we walk, as we go into fiscal 25, I already mentioned this, so I won't belabor it. Lingering economic issues. You know, pharmaceuticals continue to see, high single, some double digit, especially those that are in high demand, like in our infusion center. And then the other things are just supplies. Supplies in general continue, and that has to do with supply chain, it has to do with manufacturing, tariffs, you can throw anything at it. But supplies, pharmaceuticals, and labor are those areas that really have a lot of our focus as an organization. And then we really need to be deliberate in our execution. We need to be nimble, and the velocity is just the speed in which we act. Because we are an open community. We don't have the ability to stop someone from entering into our community and competing with us, right? And so we need to be on the mark and faster. And that's what we're committed to with our new strategic plan and the long-range financial plan that Jessica's going to talk about. And with that, I'll turn it over to Jessica.
Yes, good evening. So as Tom mentioned, a little bit about the road to recovery for the past 3 years really has been about getting the operations back to a more stable environment after the pandemic. And there was a lot of really good things that happened in the road to recovery. But what we really want to focus on more now that the road to recovery has ended its final year is really focus on the future. And so we're really going to transition from the road to recovery to a strategic long-range financial plan. And this is going to really look forward in the next 3 to 5 years. And really putting together finance, operations, strategy, kind of all together, really making sure that where we're putting our money, we're getting our best returns for and executing efficiently, as Tom mentioned, as well. And so in the long range plan, we hope to get to break even in operating income and an operating margin of 10%. So we will be working on that over the next several months to bring forward what that long range plan for the next 3 to 5 years will look like. Next slide.
Yeah, one sec, Jessica.
Oh.
One way to think about the road to recovery versus the long-range financial plan is there are some long-range financial plan concepts within the road to recovery, but we need to be knowing where the market is going, where healthcare is going, and that's more of a focus of the long-range financial plan. So think of it as you're driving a car. Are you looking right out over the hood, or are you looking down the road? And the past is, we kind of look down over the hood. How do we fix this? And the long-range plan says, what's going to happen, and do we want to fix that, or do we want to do this? That makes sense. Okay.
Yeah. Okay, so that leads us into FY25 budget. Some of the volume assumptions that are baked into our budget. We are increasing inpatient volume by 1,800 cases. You can see the breakout. Obviously, the largest piece there is the 850 cases for trauma that we're assuming in the budget. And then our outpatient volume, we are anticipating, given where we're seeing the market go, as more volumes moving to outpatient than it is inpatient. We are increasing outpatient volume a little bit faster than inpatient for the FY25 budget, and increasing by about 3,600 cases. You can see the breakout there is, 600 cases in ER. Obviously, we have more cases in trauma at the 600, but wanted to point out we also have about 600 cases in some of our new imaging equipment we're bringing on board that you guys have already approved. So that's really helping the budget as well. Next slide is the expense assumptions for FY25 budget. So just a couple of highlights here. As we mentioned, salaries and wages is obviously our biggest pressure point. We have reviewed and reduced some overtime in just a handful of targeted areas. We did increase FTEs for trauma, which I'll show in a couple of slides, and we did increase the wage rates based on the contracts that were negotiated already, as well as a 5% for non-represented. We did see an increase in employee benefits. Most of that is from the salaries and wage increase and the trauma FTEs that we increased. Professional fees, supplies were both increases, again, due to our trauma volume. PG&E increased rates by about 25% for the coming year, so utilities increased. Software and licenses is just our annual fees and maintenance. Marketing and advertising increased due to a new brand rollout that we're going to do. I mentioned the mobile MRI and PET CT that we have implemented, so there's some cost to those pieces of equipment that increased other expenses. and then depreciation remains about flat, and then purchase services is due to some trauma volume as well. So if you go to the next slide, we really wanted to show some of the trauma impact, because that's obviously carrying, as you'll see in some of our statistics, a lot of increases into our operations. The chart on the left is a waterfall chart. And so what we wanted to show is that without trauma, we're budgeting about $2.5 billion in gross revenue, which is only about a 55% increase over April annualized, and a 2.3% increase. So we do feel like we're being conservative in our estimates for gross revenue increase. And then that next line, you can see the 850 trauma cases that I mentioned is going to bring in about $153 million in gross revenue. And then we have ED discharges as well on the outpatient side that's going to bring in another $20 million. And so when we add trauma assumptions, that does bring our gross revenue up to $2.6 billion. That is a $228 million increase, or 9.5% increase. Some of the expense assumptions I mentioned on the other slide, but these are a little more detailed. We are being very conservative in our payer mix when it's related to trauma. We are assuming our current run rates for trauma cases, although we do anticipate that that will be better going forward. So we think there's some upside in the budget here. I mentioned we did add 104 FTEs based on that trauma volume. Some were FTEs in some of the departments that will be impacted, and then some were dedicated FTEs to trauma. I mentioned the professional fees. We did have an increase there for call pay, the medical directorship, and the hospitalist fee. Supplies, again, we did do a slight increase in our run rate just based on the types of cases and needing more supplies for these trauma cases. So we did do a slight increase in our run rate that got to the $6 million for additional supplies. And then we did add in a $1.5 million trauma contingency just so because we don't know what we don't know.
And I would just like to clarify, the 104 FTEs are not adds, right? So if the volume's there, the FTE would increase. It's not like we're adding head count. It's just, if volume's there, we need to staff it, and that equates to another 104 FTEs over the base budget.
Next slide. Tom, I'll turn this over to you.
Okay. So this is the fiscal 25 hospital P&L, profit and loss statement. Starting with the left column, projected 24. This is as of April, as noted at the bottom of the page. We are projecting a $2.4 billion in gross revenue with $1.9 billion in contractuals. We're on track to get about $11.5 million in other income, rental income and supplemental income from the state programs. So net revenue is going to come in around $568 million. The contractual on that equates to about a 77% or 76.9%. And then down at the bottom, total operating expenses, I won't go line by line, but total operating expenses are $570 million on a projected basis. Our EBITDA is going to wind up somewhere close to $37 million. Net operating income, currently we're going to be around $2.6 million in the hole, sorry. 2.6 million in the hole. But that's plus or minus about a million. We just don't know what June is yet. Our census has gone up and down. And so we do expect some improvement on that. Non-operating income at $16 million brings us to a net income of projected net income of $13.4 million. So now we take that annualized we average it with the fiscal 23 actuals, and we came up with a budget. We've worked with all of the professionals and the physicians and the departments to come up with realistic, conservative growth rates for fiscal 25, and that's represented together with trauma in the next column. So there's the $2.6 billion in gross charges, an increase in contractuals due to the increased volume at $2 billion. Other income is 16.9. We have a directed payment program starting in fiscal 25, so the increase over the 24 number to the 25 number is definitely reflective of that directed payment coming in. So that brings us to net revenue of $622 million, contractual of 77.1. And then if you go down to total operating expenses, $617.6 million. Our EBITDA is projected at $43 million with a net operating income of $4,100,000. Non-op is 12.7, bringing our net income for fiscal 25 to $16.8 million, or a 25% increase over where we think we'll land for fiscal 24. Some of our key statistics for the hospital discharges, you see it has about a 13% increase. Much of that is trauma related. If we didn't have that, it would not be 13%, it would be about a 4%. Next, though, I do want to spend a little bit more time on this slide, discharges per payer. I think it's important to note that in 22, 23, and 24, we were kind of stable, 46, 47% in Medicare. But as you can see, our current run rate for fiscal 25 has a 54% number for Medicare. And you can also see the PPO in 22 is at 27, and we're budgeting for fiscal 25 at 21. So there is a shift going on. We don't know if that's moving from commercial into Medicare due to the age, or if we have older people coming in. We're looking into it. But there is a shift, and again, it's being conservative. Patient days, 11% increase, and this is again factoring in trauma. Average daily census, this is one of the areas where we were able to separate the difference between base budget and trauma's impact. So our daily census is projected to be about 157 for fiscal 24. The budget for fiscal 24 on the base hospital has us at 163, or about a 4% increase. When we add in trauma, that adds another 12 days to 175. So about 11% increase, which is consistent with the 11% you saw on the volume from trauma. Outpatient observation days increasing by 22%, and again, a large portion of that is trauma related. However, observation days in and of themselves are not bad. It's really around, of those days, how many did we get paid for? And so we'll be moving forward with some additional reporting on observations going into fiscal 25. It's just reporting a static number like this.
Tom?
Yeah.
Somehow I had the idea that it was very difficult to get payment for outpatient observation days.
I wouldn't say you're wrong. We are looking, and one of the things that we were able to accomplish in fiscal 24 was getting Alameda Alliance, the HMO, Medical, to pay us $100 an hour for 48 hours. So we are working with that on the other contracts as well, with some of our major commercial payers, to see if that will take flight. And if not, then you're not wrong.
And it also depends on how many observation days per patient, because there are certain patients that only qualify for observation, but it's how long they stay in that. You know, they'll, as Tom mentioned, the payer will pay for 2 days or 48 hours usually, but if they stay longer, that's where we run into issues in terms of payment too. So that's why these statistics, they don't get the full story, and that's where we need to, we've got some other data around it too.
Tom, on that, on the payer, when you say the HMO, does that cover the Medi-Cal HMOs too, or no?
No, the Medi-Cal is Medi-Cal.
Okay.
The HMO is really around managed care, which could be the managed Medicare, which pays a little better.
Yeah, because, there is a mainstream HMO
Yeah.
for Medi-Cal too.
Yes.
So.
Yes, and that's Alameda, right?
Alameda Alliance.
Yeah.
And Blue Shield, yes.
What's that?
And Blue Shield.
Yes. But Blue Shield no longer operates in Alameda. And so they lost theirs, and Alameda picked it up. Alameda Alliance. Average length of stay decreasing by about 1.8%. And again, with trauma, it's 5.1, because remember, it's very clear. Your DRGs tell you, what to expect, and you move to that DRG. And we have some improvement in our throughput, so there is a decrease here of 5.3. Deliveries are pretty flat, 2% increase. We're projecting 1,502 for the fiscal year of '24 and 1,531 in fiscal '25. Total surgical and cath lab cases. This is just a bar chart. We'll get to the detail on the next slide. The bottom is cath lab, the middle, or the upper bar is surgical. And you can see the 4.5% increase without trauma on surgical volume is 14.1% increase with trauma, which represents about an additional 542 cases that would be surgical. Out of those 850 that we said would be admitted, 542 go there and not to med surg. And this is the breakdown. Surgical cases, and you can see the trauma cases at the bottom on the top, and then the cath lab cases below. Outpatient visits, 8% increase in the ED, which is a combination of the basically 1,450 trauma cases coming in, and the 2% increase that ED that they budgeted for fiscal '25 just based on their volume. Jessica.
She's on mute. You're on mute.
Yes, I am. Sorry. With labor productivity indicators, so you can see there, we talked about the 104 that were added due to the trauma volume. So the productive FTEs with trauma is 104. Productive FTEs without trauma, you can see there is the 1,453. So increased by about 8.5 FTEs or remained relatively flat. So total productivity FTEs increased a total of 112 FTEs or 7.8% increase. Non-productive FTEs we're actually decreasing this slightly. So you can see it's 204 with a variance of 9.4 FTEs or almost 4.5% decrease in non-productive FTEs. So total paid FTEs is going to be about 1,762 FTEs. It's an increase of 103 or 6.2%. The paid FTEs and productive FTEs per adjusted occupied bed does include the trauma numbers. And so you can see there, the paid FTEs is going to be about 5.93 or 2% increase, and the productive FTEs is remaining relatively flat at 0.7% increase. So to jump into some of the financial dollars based on those stats. So net operating income, you can see here we did use April year-to-date annualized for projected FY24. Tom alluded, we do anticipate we're going to be losing about $2.6 million at the hospital. And then you can see there the gray bar is Whitmouth and the orange is Devco. And so our consolidated net operating income is estimating to be around 29.1 using April annualized. For FY24, we are seeing an increase. So budget 25 for the hospital is the 4.1. Devco is also experiencing an increase in FY25 at the 9.6. So our consolidated NOI is improving from 29.1 to 19.5 NOI, still at a loss. Next slide is the net income slide. So similar story. Hospital is improving year over year. Devco is also improving year over year. And so that really helps our consolidated. So at the consolidated level, our net income is a negative 17.9 estimated for FY24 using April year-to-date annualized. We're expecting that to improve to a negative 11.9 in the budgeted 25 numbers. Next slide. So this is total operating revenue. Again, you can see there the increase without trauma is about $584 million or a 3% increase. We are expecting about $38 million in total operating revenue increase to get us to the 621.8, and that is a 9.5% increase. Operating expenses, we kind of went through these in the assumptions. So again, you can see their budgeted FY25 is about $618 million. We are increasing expenses by $47 million. A lot of that is due to trauma volume and just inflation and that sort of thing. And it's increasing by 8.2%. The chart you can see our labor costs, which is salaries and benefits, is 63% of all of the expenses, with supplies coming in second at 14%, and then purchase services and professional fees coming in at 13% of the total cost. Tom, EBITDA?
Okay. Yep. So I already mentioned earlier, EBITDA, or earnings before interest, depreciation, and amortization, total operating revenue projections for fiscal 24 on the left, making our operating margin a negative 0.5%, and an EBITDA margin of 6.5%. In fiscal 25, we are budgeting at $43 million in EBITDA. Depreciation is at 38.8. So we take that out, we have an operating margin of positive 0.7 at 4.1, and an EBITDA margin of 6.9. So ongoing strengthening there. On the non-op side, in keeping with past practice, and because we do not budget the unrealized gain losses on investments, so we're looking at 12.7 in non-op for fiscal 25, which is a reduction of about $3 million. If you remember, in fiscal 24, we had 4.7 come in as foundation donation, which explains some of that variance. And then I talked earlier about some of the accomplishments that we've attained. So in fiscal 24, IJR, the expansion, or affectionately known here as the Garden Clinic, that has been, for most part, completed. FOC cardiology cardiology's move into FOC has been completed. The bridge has been completed. Trauma preparedness, done, ready. Everybody's excited for Monday. Anxious. And then routine capital, we did with $6 million.
And then for FY25, our capital budget, some of our strategic initiatives that will be funded by either operations, foundation, or bonds. We do have our Warm Springs build out that we mentioned earlier in the slides that will be moving forward. We do have the phase 3 of the hospital master plan. Some of the cancer and infusion center is also moving forward. The infill project is also moving forward, as well as some TI improvements that will be happening. Urgent care is also going in, and we're also implementing an ERP system. On the next slide is our routine capital. Oh.
Sorry, I just want to explain the rental property TI. So that's where we're the landlord and we have tenants improving their space per the contract. So we just budget that as a placeholder.
Yeah, and also some of these are not the total cost as we know of the projects. This is what might be, what estimates of spent would be spent for this next fiscal year. So I just want to make that clear too.
Here is a list of some of the routine capital equipment and projects that have been submitted. You can see there, Tom mentioned the storage, making sure we have storage from a cybersecurity perspective, some equipment for trauma and equipment replacements. And so altogether, from a routine perspective, we are looking at spending $8.6 million. So the strategic projects, which I just realized I have those backwards on the slide. So the strategic projects are actually the $29.7 million we'll be spending. The routine projects are going to be the 8.6. So in total, we are anticipating spending about $38.3 million in capital for this year.
Are there any questions? If not, that concludes our presentation.
I was just curious, they haven't moved into the garden clinic yet, is that true?
They have not. They are just finishing up, and then we have to get a CDPH approval and that piece of it. So working with Kristen as to whether or not they're going to actually come on site or what are those pieces. So we're getting towards the end.
I was just curious.
Yes. I think they've got the moves and all that scheduled. So yep. Other questions? I do just really want to thank Tom and Jessica. Jessica, as you know, is relatively new to this organization and truly jumped in with 2 feet and everything. And I just want to say she has been amazingly collaborative and very good at communicating. And so really want to thank her. Also want to, of course, thank Tom to bring a lot of that financial strategic vision to helping us to look ahead and not just over the carpet, as he was saying. That also, this budget, there are some unknowns, as you heard, especially around trauma, but we've been able to isolate it to the extent to sort of be able to know what is sort of our base budget, and then with trauma on top of that. So we will see soon how some of this all plays out. We worked with our consultants and others to put in what was or is the best estimate that we could and can, but we'll have to see from that standpoint. But I also do want to thank the VPs and the executive team. Everybody has put in a number of hours to get this budget to be able to present here tonight. And do want to thank everybody. But again, thank you, Tom and Jessica, especially for the hard work, too.
Our pleasure, and it was Jessica's hard work. But I do want to recognize Kimberly, the VPs, the executive team as well, because it's our budget. And this was done as a collaborative effort this year. I truly appreciate it.
Thank you, Tom, Jessica, and the whole team. Thanks. So we can move on to, so we got some action items.
Yes, we have a number of action items this evening.
Would you like to introduce the first one, Mr. President? Action item A, consideration of resolution number 1264, budget for the Morris Hyman Critical Care Pavilion infill project. Mr. President, I move for adoption of resolution number 1264, the project budget of $87,464,729 for the Morris Hyman Critical Care Pavilion infill project, and direct the Chief Executive Officer to execute the proper documents and notifications to seek competitive bids for this project.
Thank you. Okay.
A second?
Yeah, I'll second. Yeah, and then we have Ed Fan that is online, and I just want him to give a little bit. This is a significant project for the healthcare system, and want Ed to give a little bit of an overview. Ed, do you want to go ahead?
Sure. Can you guys hear me okay?
Yeah.
Yes.
Okay. So, yes, this is a project to complete the build out of Morris Hyman. As you may recall, we had about 59,000 square feet of unimproved shell space on the first floor and in the basement. And those are slated to be improved for the operating rooms, to move over in total, which means 8 operating rooms, PACU and holding area, all to come over to the first floor, behind the main, what is now the main lobby in Morris Hyman. And that the big add here are the 3 hybrid ORs for cardiac, neuro, and trauma surgery. And so it's basically a replacement for what is in the 6-story tower. Directly beneath the ORs is going to be the central sterile department. So we hope to have a very efficient system where we've got elevators directly below, running up and down, one clean, one dirty, of all the instrumentation. And we have space in the ORs for those to be held before each case out in the hallway directly behind each operating room. And there's also on the basement level, there are, that's where the locker rooms are going to be, with, again, direct elevator access. So you would change and go directly up to the OR area. Both staff and physicians. The other department is the imaging department, which would move all of our imaging functions to the basement. This, of course, will include a 3T MRI, which is going to be the first time we have that in the acute care building. But everything else, CT, nuclear medicine, ultrasound, all moved into the basement, and basically, replacing everything that's in the six-story tower and the old 1958 building. And then finally, we have the pharmacy department that will be relocated out of the basement of the 6-story tower over to the basement of Morris Hyman, and that they'll see a significant increase in space. You're probably aware that their space, while we've done some things to improve workflow in there, they've had basically the same space with a little addition for the last 30 or 40 years. So, significantly increase their space and have two separate sterile compounding rooms with state-of-the-art hoods. So as Dr. Nicholson mentioned, so the construction costs right now are projected at $52 million. We've got design and project management fees at $11 million, testing, inspection, and OSHPD at $3 million. And the equipment budget is a big one, $21 million, and that includes $15 million just for the medical equipment, which includes some of the things I've talked about. MRIs, CTs, 3 cath lab rooms, new processing equipment, equipment intensive. And we're still working away to make sure we can bring all that in under budget. And obviously those aren't covered by the bond issue. That's all got to be internally funded. So again, total cost of $87,464,729.
Ed, could you tell us the anticipated timeline?
Sure. We would expect we're going to come back in one of the future meetings of probably July to talk about how we're going to bid this, which is going to be a little bit different than the direct competitive bid or the advertised bid. We anticipate to have final OSHPD approval in September or early October of this year. So we anticipate going out to bid in a July-August timeframe so that we get bids in about the time we get the final approvals. And then I think we're going to be looking at, I believe the timeline is an 18-month period to get the whole thing done. I can go back and just double check my schedule and make sure I'm giving you the exact date. But that's the basic timeline that we're looking at.
So we think we'll be operational mid-2026.
Yeah. Yeah.
Okay. Thank you.
You're welcome.
Thank you.
Okay, I can take roll. Okay, so Director Eapen,
Aye.
Dr. Wallace, Dr. Nicholson,
Aye.
Dr. Yee,
Aye.
and Director Stewart.
Aye.
Thank you.
All right, Director Nicholson, item B.
Item B, this is for Tom and Jessica. This is item B, consideration of resolution number 1265, budget estimate fiscal year 2024-2025. Mr. President, I move for adoption of resolution number 1265, budget estimate fiscal year 24-25.
Second.
Okay, Director Eapen,
Aye.
Director Wallace, Dr. Nicholson,
Aye.
Dr. Yee,
Aye.
and Director Stewart.
Aye.
Thank you.
Thank you again, Tom and Jessica.
Yeah.
All right. Item C, Dr. Nicholson.
And this is for patients. Item C, consideration of bids for the UCSF WHHS Cancer Center project. Mr. President, I move that the Board of Directors accept the bid received from XL Construction for this cancer center project and direct the Chief Executive Officer to enter into and execute the necessary contractual documents to complete this project.
I'll second that. As you can see, we did bring forward the budget almost a year ago, and so we're very excited to be moving this project forward for our patients and the community. We did have 5 contractors submit construction bids that were opened on June 11th, 2024, and our recommendation is to go forward, as mentioned, with XL Construction that is within the budget.
Director Eapen,
Aye.
Dr. Wallace, Dr. Nicholson,
Aye.
Dr. Yee,
Aye.
and Director Stewart.
Aye.
Thank you.
Again, do we have a projected completion time on this?
Yeah, I believe once we've got the contractor on board, but I believe it will take about 9 to 12 months to build out. So I think we were thinking sort of the fall time in terms of 2025. So fall towards the end of the year.
All right, moving on to item D.
D, so this is for our patients and their doctors. Consideration of Phase 1, Fremont Office Center, project management and architectural fees. Mr. President, I move that the Board of Directors authorize the Chief Executive Officer to proceed with entering into the necessary agreements for project management and architect schematic design in an amount not to exceed $2,367,316. The amount identified as necessary for this phase will be partially funded by budgeted fiscal year 25 capital budget funds and from operational cash flow.
Second. As we've talked about, Washington Township Medical Foundation is made up of many clinics throughout our whole district. I think there's around 21 of them. And we feel in terms of being able to better serve our patients under one roof and also for gaining efficiencies. And as you know, we purchased Fremont Office Center, and we're looking to, in a phased approach, move forward with bringing those clinics under one roof. And we're going to be starting with our primary care, women's health, and pediatric clinics, along with a welcome center. So this is really that first, the architectural design and management.
Director Eaton?
Aye.
Director Wallace? Director Nicholson?
Aye.
Director Yee?
Aye.
And Director Stewart?
Aye.
Thank you.
That is a lovely, lovely facility. I've been in it, I've worked with some of the doctors over there. That is really a nice facility.
Yeah, and cardiology has moved in.
Yeah.
Yep. We're very excited.
Very fortunate to have that.
Great. Those are the action items for this evening.
Any announcements?
We have no announcements.
All right, then, on to the closed session.
Right.
We'll now go into a closed session. However, before doing so, I want to let the public know that they have a right to know what reportable action, if any, was taken by the board during the closed session. Normally, the board would make the announcement following the closed session. We do not know how long the closed session will last. We do not want members of the public waiting indefinitely for the board's report. Therefore, we ask that you contact the district clerk tomorrow. She will be happy to respond to any inquiries about the reportable board actions. Our minutes will continue to reflect any reportable actions taken. Thank you. The board will now adjourn to a closed session.